related to growth issues and hormonal issues that were a result of disruption of those activities because of their therapies. Not surprisingly, diagnosis and treatment, because it affected their health, also affected their health care. But reassuringly for us, factors that related to access to care, such as the region of residence, living in a rural location, or socioeconomic status, did not affect utilization in general, although we did see that individuals living in the north or living in rural areas more often had hospitalizations and had fewer visits to specialists, basically because they weren't available in their region. So interestingly, when we looked at the types of specialists that these individuals saw most often, not surprisingly, we did see excess of particular dermatologists. We know radiation affects the skin, neurologists, and we know that the drugs do affect, and radiation can affect cognitive functioning and affect the nervous system. We know that hearing and eye problems can develop depending on some of the drugs available. And that internal medicine specialists were very involved in the more complex cases. So it's one thing to see excess health care for these individuals, but is this the right health care? Are these survivors receiving the type of interventions that will actually appropriately manage their health? So it turns out that in the United States, there is a set of guidelines, not